Okay, we're doing our newborn assessment, Passoff. I'm just gonna do some standard precautions. I put hand sanitizer on, but I'm not going to because it's a pain in the butt with these gloves. We come in, we're gonna grab baby, we're gonna make sure that, well, we don't have ID bands on yet, but we make sure that this is the right baby. We're gonna bring baby over here and put her underneath a warmer. That way she's not having any cold stress. We're gonna dry baby off. Baby all dried off here. And then make sure that they are safe. We're gonna do nose suctioning, suction their mouth first, and then their nose. We're gonna place this ID band on her so that we don't have any mishaps, don't have baby get lost or given to a different mom. And then we're gonna do 1 minute and 5 minute APGAR scores. Make sure that she's has the color in her face. I'm just observing her as we're doing this. For the first APGAR score, it was an 8, and then for a second for the 5 minute one, it was 9. And then we're just gonna assess baby and go down. I'm just gonna assess her fontanelles, make sure that they're present, make sure that she doesn't have any swelling, any hematomas. If she did, we would note that and make sure that it's in the chart. Assess baby's eyes, ears, mouth, and nose, and then I'd place my finger in her mouth and make sure that she does have that sucking reflex. And then also the stroking of the cheek and make sure she has that feeding reflex as well. And I'm just gonna flip baby over right here and we're gonna assess her spine. Make sure that she doesn't have a tuft of hair or a dimple right here, anything like that. I'm gonna place this on baby's head since we've already observed that, just to keep her warm. And then we're gonna place a diaper on her. We want to make sure that she does have a void and passes that meconium in the first day that she's born. And then I'm just gonna go down assessing all of baby's different systems and make sure everything's okay there. I'm gonna assess her heart rate, her lungs, and her bowel sounds first. I'm just listening for any abnormal breathing sounds, any abnormal lung sounds. Make sure that sound is present in her bowel area. Everything's good there. And then we're also going to want to assess her umbilicus, make sure that if the umbilical cord is still on there, make sure there's no like hernia, bleeding, and problems there. And then I'm just gonna assess her reflexes, make sure that she does have where you lift the arm and the baby's head turns towards, and same with this one. We wanna check the baby's neck reflexes and make sure that she doesn't have a broken clavicle on either side. We would, first of all, we would measure baby's head circumference, which I should have done this before I placed this hat on her, but measure the head circumference, measure the chest circumference, and then also the abdominal circumference. Just gonna do that real quick. Measure the chest circumference, perfect. And then we also want to weigh baby. We got her on the scale, we just weigh her. And then I'm just gonna palpate her abdomen, make sure there's no, like she's not crying in pain or grimacing once I do palpate her abdomen. Make sure there's no bumps, lumps, anything like that. And then we're just gonna assess her palmar grasps, assess the plantar grasps, and then the Babinski reflex. We wanna check her hips, make sure that there's no pain lifting that up, make sure she does have that movement. We'd feel her brachial pulses, and then we'd feel the femoral pulses to make sure that she doesn't have any, like a pulse defect, make sure she is getting that blood flow. We'd want to do her cap refill. We'll do her vital signs, put the pulse oximeter on her, do her blood pressure, do an axillary temperature. With this one looks like a mouth temperature, but we do make sure she's within normal limits there. And then we're also going to give her this vitamin K shot so that she does have the clotting factor. Babies are born without that or don't have very much of it, so we want to give her the vitamin K shot. And then we're also going to give her this eye ointment so that in case mom did have STD or anything like that, it doesn't travel into baby's system and give them an infection as well. Let's see. Now I'm just gonna wrap baby up. Make sure she still has that ID band on. And then we're going to bring her back to mom and then see whether or not she's breastfeeding or bottle feeding, and then we'd want to teach her how to breastfeed if she doesn't know how to already. This mom has already had a baby. We just want to reinforce those techniques and stuff like that. Make sure baby has a good latch and teach her how to change things if she doesn't have a good latch. And then we'd also want to teach her what to watch for if baby is having any respiratory stress, anything like that. Make sure to watch for the bowel movements, the stool. Make sure baby has some wet diapers, and then make sure they're feeding well and just check up on them and make sure everything's good.